Good morning, everyone. Today's topic is general anesthetics. These are the pharmacological agents which, when administered externally, they brings the loss of all five modalities of sensation with reversible loss of consciousness. The progress of general anesthesia from the point of induction of anesthetics, it is divided into four stages. Stages of general anesthesia are given as stage of analgesia, stage of excitement, stage of surgical anesthesia, and stage of respiratory paralysis. The stage of analgesia is in between the induction of anesthesia to the loss of consciousness. In this stage, the all reflexes are present and this stage is suitable for dental and minor surgery. In stage 2, this stage is extend from the loss of consciousness to the beginning of surgical anesthesia. This is associated with omitting and increasing muscular activity. This stage is not suitable for the surgical procedures. Then third one is stage of surgical anesthesia. Stage of surgical anesthesia starts when patient excitement is stopped and breathing is regularized. In this, the skeletal muscles get relaxed and all reflexes are absent. This include four plane. Plane 1, in this pupil are normal and eyeball moving. Plane 2, in this eyeballs are fixed and respiration is regular. In plane 3, BP falls and muscular relaxation. And in plane 4, pupils are dilated and not respond to bright light. In stage 4, the stage of respiratory paralysis, due to the excessive administration of anesthetic agents, the patient passes the fourth stage, that is stage of respiratory paralysis. In this, there is stopping of breathing and there is a decrease in blood pressure which leads to death of the patient. Properties of general anesthetics. Easy to administer, they should produce rapid and smooth induction and recovery. They should be non-irritant. They should possess adequate muscle relaxation. Not have any effect on liver, kidney and heart. They should have sufficient margin of safety. The signs and stages of the anesthesia should be clear. These are the ideal properties of a general anesthetics. The classification of general anesthetics includes volatile and non-volatile anesthetics. Volatile anesthetics includes liquid and gaseous. The liquid anesthetics, example of liquid anesthetics are chloroform and ether, and gaseous anesthetics example is cyclopropane and nitrous oxide. Second one is intravenous, which are also known as the non-volatile anesthetics. First is barbiturate, example is thiopental, and second one is non-barbiturate, for example ketamine. The advantages of volatile or inhalatory anesthetics. First one is ether. Ether, the advantages of ether is it has wide margin of safety. It is safe as well as a good anesthetics. It is good muscular. It produces the good muscular relaxation. It does not have any effect on liver, kidney and heart, and it is the economical agent. Advantages of ether is the induction is slow and recovery also slow. It is irritant and increases the salivary and bronchial secretions, so it produces the cough. It is highly explosive. In children, it may produce the convulsions. Chloroform no more used because of it produces hepatotoxicity, nephrotoxicity and cardiotoxicity. Nitrous oxide. The advantages of nitrous oxide is it is non-inflammable and non-irritant. It has rapid induction as well as recovery. It is the good analgesic effect and it is used in dental practice. Disadvantages in it includes pre-anesthetics medication required, and the excitement may be violent. In non-volatile intravenous anesthetics, advantages of non-volatile intravenous anesthetics are these are easy to administer, the induction of anesthesia is rapid and smooth, the recovery is very fast, no irritation in respiratory passage. Disadvantages of non-volatile intravenous anesthetics are stages are not clear, coughing, apnea is common during the induction, and muscular relaxation is very poor. Pre-anesthetic medication. Pre-anesthetic medication means with an important objective to make an anesthesia more smooth for the patient and the surgeon. The drugs are administered are known as pre-anesthetic medication. These are the pharmacological agents which when administered with an important objective to make the anesthesia more smooth for the patient and the surgeon. The aims and objectives of pre-anesthetic medication includes to decrease the dose of anesthetics, to minimize the adverse effect of anesthesia for producing sedation effect, to decrease the anxiety, to minimize the post-operative complications, to produce adequate skeletal muscle relaxation, and to obtain the additive or synergistic effect. Which are used as a pre-anesthetic medications are first is narcotic analgesics, for example morphine for their analgesic effect. Second one is barbiturate, which include diazepam. It is used for the sedation and to reduce the anxiety. Third one is antiemetic, for example promethazine to prevent the emesis, and anticholinergic drugs, for example atropine to decrease the salivary and respiratory secretions. These are the drugs which are used as a pre-anesthetic medication to make the anesthesia more smooth for the patient and the surgeon. Some give reasons are given as first is chloroform is not a good anesthetics or chloroform is not used nowadays. As we seen, it produces more toxic effect on liver, kidney and heart, so it has lesser margin of safety. It produces hepatotoxicity, nephrotoxicity and cardiotoxicity. Hence chloroform is not used nowadays. Hence chloroform is not a good general anesthetic. Second one is atropine is used in pre-anesthetic medication. As atropine is a anticholinergic drug, it decreases salivary and respiratory secretion. In inhalation anesthetic causes excessive secretion. Intravenous anesthetic does not cause excessive secretion, but in stage of delirium or excitement, vomiting can be occur, and in unconscious stage it may cause respiratory arrest. Atropine inhibit all secretion, hence it is used in pre-anesthetic medication. Third one is atropine is used in general anesthetic with ethers. As it decreases or inhibit the secretion, hence it is used with ether. Next one is ether is stored in amber colored bottle. Ether, it is the volatile liquid general anesthetic. The vapors of ether is irritating to nose and eyes, so it causes increase in irritation. It is oxidized in air, and to avoid the irritation and the oxidation, it is stored in amber colored bottle. Next one is halothane and cyclopropane are costly general anesthetics. Both the drug are required special apparatus for administration. They have poor analgesics and poor skeletal muscle relaxation property. For the analgesics and skeletal muscle relaxation, there is needed to be given pre-anesthetic medication. This adds to cost of drug, hence they are costly. Thank you so much for being there. These are about the pre-anesthetic medication, general anesthetic, stages of general anesthetics, ideal properties, pre-anesthetic medication, drugs used in pre-anesthetic medication, and some give reason